The Diagnostic and Statistical Manual of Mental Disorders 5th edition, or DSM-5, is a classification system of mental disorders that is commonly used in Australia. The DSM-5 categorizes mental conditions according to a cluster of symptoms. The DSM uses a categorical model of diagnosis. This categorical approach is based on the medical model, which means that an individual is seen to either have an illness or to not have the illness. For example, in the medical world, based on blood tests, an individual might be diagnosed with diabetes. There is a cut-off value that indicates the presence of an illness. This is transferred to mental illness, and hence the categorical model of personality disorders in the DSM-5 proposes that a person either has a personality disorder or does not have a personality disorder. There is no gray zone. Using the categorical model, each personality disorder is seen as distinct from the other personality disorders and also seen as distinct from normal personality, which of course is a contentious issue. Interestingly, the DSM-5 also proposes an alternative dimensional model of personality disorders. This dimensional model views a number of personality characteristics to be on a continuum. Along each dimension, there are varying degrees of severity, ranging from mild to severe. On these dimensions, healthy personality characteristics are at one end, and disordered personality characteristics are at the other end of this continuous dimension. Let's take the example of narcissism. One symptom of narcissism and narcissistic personality disorder, or NPD, is extreme self-centeredness that is displayed in all areas of the person's life most of the time. However, everyone will sometime act in a way that is a little self-centered. This does not mean that they are self-centered in all areas of their lives or most of the time, or that they have NPD. The dimension of self-centeredness, in other words, applies to a person with NPD and also to a person who is sometimes self-centered. The difference lies in severity. Are they self-centered across all areas all the time, or just sometimes? It is easy to think that you or someone else has a personality disorder, particularly when you can recognize some characteristics. However, please beware of self-diagnosis or of diagnosing others. Instead of diagnosing yourself or someone else, please seek out the help of a mental health professional, particularly a mental health professional who has extensive experience with personality disorders, and ask their opinion